Welcome to AETCM, the emergency medicine channel. So this part we are going to continue the medication administration. So last part we discussed regarding the enteral route of drug administration, right? So in this part we are going to enlighten on the parenteral route of drug administration. So in parenteral route, definition wise, this is nothing but, so apart from the enteral route, which are the ways we are using, that is comes under the parenteral. Absolutely, we have to divide, we have to separate that local route. So apart from that local and then enteral route, what are the route we are using, that is comes under the parenteral route. So the most common routes are IV, intravenous, intraosseous, intradermal, subcutaneous, and then your intramuscular. So these are the common routes we are going to focus on today's topic. Mainly parenteral route, before getting into the topic, we have to know something regarding the what are the articles needed for the your medication administration for the parenteral. So before that we have to know two common things. First one, syringe related things. Second one, medication preparation, how the medication will available for the parenteral drug of administration. Okay, syringe wise, so you have a various means. We'll start from the syringe first, needle we'll talk later. So syringe, basic two parts, you have a barrel and then this is the plunger portion of the syringe. So this is plunger portion, so inside that inner diameter, that is completely sterile, so you should not touch. Once if you touch the portion, you have to discard, so you have to reuse the another one. Okay, so this is the first one. And then this is coming into the needle part. So needle, it will be sizes vary from the 18 to 26. So commonly that 18 and all we are using for the medication for dilution purpose and then loading purpose. Mainly for IM and then intradermal, you have to use the 26 for the intradermal, 24 for the your intramuscular injection. Okay, so you can see, so if the size is increasing, so means we used to call as a gauge, 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 sorry, GAUGE, gauge, 24 gauge, 26 gauge, like that. So when the size is increasing means that diameter also will decrease, means 18 gauge will be in a larger diameter, your 26 will be in a smaller diameter. So that is the difference you should know. So mainly I told 26 for the intradermal and then subcutaneous also you can use. So this is the your 24 gauge, this is for your intramuscular injection. So and then again for subcutaneous we are using the mainly for insulin syringes also we are using. Okay, so this needle name is called hypodermic needle. Hypo in the sense low, dermic in the sense your dermis layer. So the needle will pass through the, or the needle will settle, or the needle will place on the below the dermis. That is why we are calling this a hypodermic needle. So this is regarding the syringe and the needle. Then coming into medication preparation. So commonly medication will available in a two format, that is vial format and then one more is a ampule format. So what are the difference between the ampules and then vials? So here you can see the ampule. So this is the single sterile glass container. So here you can see the vial, it is a glass container, but it is a glass container. So sometimes before they ampules and all, vials and all, it came in the plastic container also. Now most of the medication we eradicated, almost it will comes in the your glass container only. So here you can see ampule, it is a breakable one, but vial is non-breakable one. Instead of that, in head portion you can see the some rubber stopper. Okay, what's the purpose of this rubber stopper means? So this is a multi-dose vial, means it will carry single dose, mean the same time multi-dose also. So once you can load and then you can reuse it after some time also. So that is why multi-dose vial. So but the thing you have to remember here is that, so one first it will comes with some seal. So once first time you can use directly. If you are going to use second time means you have to clean this area with the alcohol wipe. So the rubber stopper you have to clean with alcohol wipe in a circular motion. Then only you have to load the drug. Though that is the purpose of this rubber stopper. But here this ampule you can break and then you can load. It will mostly carry the single dose only. So this is the difference between the ampules and then vials. Now we'll get into the procedure. First we'll start with the intradermal, then subcutaneous, then intramuscular. Finally, already we discussed regarding the intravenous related. We have posted the video. You can check out that one. Intraosseous we are planning as a separate video. Might be it will be in a next video. So there we will discuss how to do the procedure. What are the precautionary steps we have to take, indication, contraindication. Everything will cover in the next part. Moving on to the first route, that is intradermal. So intradermal, the name itself clearly explaining. So we are going to deposit the drug into the dermis layer. Okay. So what are the common routes we can use? Common sites we can use means, that is the first thing is the anterior aspect of the forearm. Then you can go with an back side, so that is a upper back region or below the scapular region, but mostly we won't go that area, mainly that we will use the anterior aspect of the forearm. Okay, then next, what is where and all we are using the intradermal route? Indication for the intradermal, mainly for the some drug doses, for test doses for the drugs, so that we are using for the intradermal drugs like antibiotics or some NSAIDs. So if you want to test dose you want to give means, there we are using the intradermal. Some vaccines like PCG also we are giving in the your intradermal route. Then moving on to the procedure, so you have to first, the remaining things and all you should follow, so like rights of medication administration, informed consent, so everything you have to take. And then I am telling about the procedure alone. So before getting into the procedure, you have to take the consent, and then you have to ideally prepare the site. So here I am going to use the anterior aspect of the arm. So here, so from center to periphery you have to clean like this. So in a circular motion, center to periphery, discard, and then take the desired drug in a desired quantity. Mainly for intradermal we will inject only 0.1 to 0.2 ml only. Mean the same time it won't accommodate that much. Along with it will be a painful procedure, you have to clearly explain to the person prior to the injection. So the angle is here clear, and then you have to wait for the drying of that area. Then you have to hold like this. So your angle should be 10 to 15 degree. So it should be superficially you have to inject. So here you can see the angle. So I am maintaining only 10 to 15 degree from the surface of the body surface. Okay, so you just inject 0.1 to 0.2 ml, then take it out. So don't recap the needle again. So if you want to just discard the needle. If you want to recap means, just to follow the scoop technique. So just to scoop and then fix the needle. Okay, so this is the way you have to do the intradermal. So remember the where we are using indication, common sites, angle 10 to 15 degree. After that you have to, if the bleed is there means, you just wipe it out and then discard. Then you have to make a round. So which are this? So if it is a test dose means, at what time you given which drug, so everything you have to mention. So this is the thing regarding the intradermal. Then moving on to the second route, that is your subcutaneous. So subcutaneous, you know, majorly we are using in the, for if you want to give a insulin or if you want to give a heparin, so anticoagulants. So there's and all we are using the subcutaneous. We are accessing the subcutaneous. Where is the subcutaneous? So you have a epidermis, dermis, and then hypodermis. So along with hypodermis you have a subcutaneous fat. So there we are going to deposit our drug. Mainly subcutaneous, why we are using? So it will be a slow absorption, because there we have a less vascular supply. So this is the one thing regarding the subcutaneous. So where and all we can inject the drug? Sides wise you can choose the upper arm, and then around the umbilicus, that is abdomen, and then anterior aspect of the thigh. So these are the three common sites where we can use for the subcutaneous injection. For here I am going to show you the how to give a subcutaneous injection in the upper arm. So here remember for upper arm, both your intramuscular and then subcutaneous, we have to follow the where we have to put the needle, that we have to landmark the area. For that, so just remember, here you have a clavicle. So clavicle bone here, and then here you have a scapula, right? So in this area you have one junction, that is a bony prominence, that is called the acromion process, right? So shoulder girdle it will form. So in this acromion process, place this 2 finger breadth. Okay, so below this 2 finger breadth you just make one V. In this V, center of the V you are going to put your needle. Okay, so first acromion process, palpate the acromion process. From that 2-finger breadth below, there you have to make a 1 V. In that center of V you are going to put your needle. So this is the area. So here I have a loaded drug with me. So before that you have to clean again center to periphery in a circular manner, and then you have to, here I am going to give the subcutaneous. So here I have a insulin. So before giving in subcutaneous, so we ideally mark the area, right? You just pinch the skin like this, and then slowly in a 45-degree angle, you just pierce the needle and then aspirate the syringe and then inject your drug. So this is the way you have to give. Okay, so first we marked the area. Second thing, so where we are going to keep the needle. Second thing, we are going to pinch the skin. So why we are pinching means, so thereby you are collecting the subcutaneous fat alone. So if your muscle is like this, means fat will be like this. So by coning like this, so subcutaneous fat alone will come. Muscles are tightly attached, or it will attach to your bone, so it won't come up. So to target the area of subcutaneous, we are coning the your skin. Okay, that is the reason. Second thing, angle should be 45-degree angle, and then you have to aspirate and then you have to give. Again, there is a lot of controversy regarding the aspiration of needle. So some of them telling you should not aspirate, and then some of them telling we have to aspirate, then only we can identify the vascular, like hitting of the vascular. So but recently I read regarding some articles regarding this issues, but that is a review article. So they reviewed various sites or various recommendation like WHO and then some other recommendation, but still now they finally concluded there is no such recommendation for the no aspiration related thing. So you can anyway, you can aspirate and then see. So that is I think a better way. So we can understand thereby we are in the only subcutaneous area, we are in only muscle area, we are not hitting on any vascular area. So that is why you can conclude the thing, but based on your local protocol you can follow the further thing. So this is regarding the subcutaneous upper arm. Now move on to the, so first we told subcutaneous upper arm, right? Now we will move on to the subcutaneous in the around the umbilicus. So this is nothing but with the consent of the person, you have to open that area, particular area, expose the area. So around the umbilicus, you just place your lateral side of the umbilical, either side upper or lower or lateral side, and then it should be 2-finger breadth away from the umbilicus. So 2-finger breadth away from the umbilicus, you just pinch the skin like this. Same with a 45-degree angle, you are going to inject the drug, aspirate and then inject. So this is the way for the your around the umbilicus. So coming into the next part, that is your vastus lateralis. So again with the permission of patient, I opened that area. So this is also same thing only. So again where we are going to inject means, so this is also subcutaneous and then intramuscular, both will come in the same area. So how you have to means, so it should be medial aspect of the thigh. Okay, so here you just palpate the greater trochanter of the femur. So you can palpate here. So from that, just place your hand one like this, in a one more hand over the above the knee. Okay, so in that middle portion we are going to inject the drug. Okay, so the greater trochanter, palpate there and then keep your hand one over there, one over the above the knee. So in that middle portion we are going to prick the needle. So if it is a subcutaneous, again 45-degree angle. If it is a intramuscular, you are going to prick in the 90-degree angle. So I have to load the drug. So the needle also you have to think that is a 24 gauge needle. So I have to load the drug and then I have to place it in the 90-degree angle. So 90-degree angle from the body surface. Okay, I am talking about the from the body surface, it is about 90 degree. So inject until the hub or until so make sure you are not hitting on the bone. If you are hitting on the bone, you just withdraw the needle some part and then you have to inject the drug, aspirate and then inject the drug. So this is regarding the anterior part of the thigh. So means rectus femoris. So majorly in our emergency setup or in a pre-hospital setup, we use something like a auto injector, right? So glucagon or adrenaline auto injector, where where which muscle we are accessing means, that is vastus lateralis. Vastus lateralis means, so this is here I have one glucagon injection. So this is the auto injector. So you have to, here it will come, so some of the thing it will come in a constituted form, here liquid form. Here I want to reconstitute again. So once after and reconstitute, you have to expel the air. then where the same area, so you have to first palpate the your greater trochanter, here one hand over the your knee, above the knee, and then middle part you are to going to prick the needle. So that is anterolateral aspect of the thigh. So for IM rectus femoris we pricked on the anterior aspect of the thigh, and then but for your injection, for your vastus lateralis, if you want to access, means you should come to the lateral aspect, okay, lateral aspect of the thigh. So here it will come approximately, here it will come. So here I am going to prick the needle in a 90-degree angle. I am going to aspirate and then I am going to inject the drug. So this is the way you have to access the rectus femoris and then vastus lateralis. Now moving on to the gluteal region. Pause. Rectus femoris we pricked on the anterior aspect of the thigh, and then but for your injection, for your vastus lateralis, if you want to access, means you should come to the lateral aspect, okay, lateral aspect of the thigh. So here it will come approximately, here it will come. So here I am going to prick the needle in a 90-degree angle. I am going to aspirate and then I am going to inject the drug. So this is the way you have to access the rectus femoris and then vastus lateralis. Now moving on to the gluteal region, then moving on to the IM injection, that is gluteus maximus. So remember, for IM, one thing we explained in the deltoid, so where we have to place the needle, angle is 90-degree. The same area we are using for subcutaneous also, but the angle will differ. 45-degree angle you have to pinch the skin. And then second area we explained the your anterior aspect of the thigh and the lateral aspect of the thigh. Fourth area, that is your gluteus maximus. Where we have to give means, so this is the gluteus maximus muscle. You have to divide into 4 portions. So like divide into 4 portions. In this outer upper region you have to prick, means, so this is the 4 region, means, so this is the outer region. So away from the body, in this outer upper region you have to prick the needle. So I'll show you. So first, so this is the area I am going to prick. So just to wipe it out, center to periphery in a circular motion, and then you have to take the syringe. So ideal drug you have to load, desired drug, and then 90-degree angle. So from the body surface area it should be 90-degree angle. Inject the drug, insert the needle, aspirate the area, and then you are injecting your desired drug. So this is the way you have to. So once after withdrawing the needle, you have to rub the area. So you have to provide the gauze or you have to provide the gamji, so to rub the area. So this is the way you have to give. So why not we are not going to prick in the innermost region, means, so here you can see the, so that innermost, that exactly in the medial region you have a vascular and then nerve supply. Okay, it is traveling through the medial and then inner area, means inner quadrant area. That is why we are picking on the this outer lateral, means our outer upper area we are going to prick. So this is the reason for the outer prick. So again, for one more thing I want to add here, that rubbing wise in the subcutaneous and then intradermal it should not be rubbed because it will cause more pain. But IM you can give us some gauze or cotton to rub that area. Okay. Finally, I want to end this presentation with the endotracheal route of drug administration. So this is also one of the things, it will help us in the emergency situation. So once if you intubated the case, if it is difficult to obtain the IV access or if you don't have a facility for the IO access, means there you can use the endotracheal route also. So the thing you have to remember in the endotracheal tube, before to give a drug, you have to ventilate the person, you have to check both lungs are ventilating, and then you have to take. So before that, what are the common drugs we can give through the endotracheal tube? There is one mnemonic called O novel. O in the sense oxygen, N in the sense naloxone, A in the sense atropine, V in the sense Ventolin or salbutamol or albuterol, and then E in the sense epinephrine, L in the sense lidocaine. So O novel drug you can give through the your endotracheal tube. Again, one more important consideration you have to remember in the endotracheal route administration, you have to take 3 to 10 times higher than the normal IV dose. Means, so if you are in a cardiac arrest, we will take 1 mg of adrenaline every 3 to 5 minutes we will give, right? Here in the case, not 1 mg, you have to take 3 to 10 mg. So that is the ideal dose for your endotracheal tube. So this is the things you have to remember before getting into the endotracheal route administration. Two ways you can give. The first way, just so here before the presentation I didn't covered much regarding the how to load the medication, because that is all easy only, there is no specific point to add on. So if you want to add means, so remember, so vial also already I mentioned. So before getting into the second dose of vial, if you want to take means, you have to wipe the vial around the rubber stopper, then only you have to load. So some of the thing you can inject the desired amount of air and then automatically it will refill. Means if you want to take a 5 ml of some XYZ drug means, you have to take 5 ml of air, then you have to inject into the vial, so passively it will reload. Or if you are going into ampule means, remember for intradermal, intramuscular, after an snap it out, or after an you are breaking up the vial, so you have to insert into the vial, then you have to take the you have to load the drug. Okay, that is the thing. Means in this time you should not touch your bevel, or your tip of the needle should not touch any area of your ambule. Okay, that is the thing you have to remember, because once if you touch or hit anywhere else means, it will blunt your tip of the needle or bevel. So better what we can do means, after unloading of the drug, you can remove the needle, you can change the needle, and then you can go for the intradermal or intramuscular. Intravenous, it's no need, because there we don't need any no need of any needles, right? So this thing you can keep in mind. So coming into the endotracheal tube, so before that you have to ventilate the person, so you have to verify and then pre-oxygenate. Then after that you have to administer the drug. So two ways I told. First way, so with the syringe you can administer, syringe and the needle. So hold the needle like this, and then you have to forcefully inject, then again you have to ventilate the person. Okay, so this is the way you can do that's the first way. Second way what we can do means, that is if you have a pediatric feeding tube or adult feeding tube, Ryle's tube means, so the depth you have to measure. So here it is about 24, I think so, 24 exactly. Okay, so up to that centimeter, or you can fix it in the middle portion of your things endotracheal tube. There after that middle portion you can inject into the drug over this area, followed by you can give the flesh. Okay, so this is the way you can go for the endotracheal. So two routes. First one with the direct help of syringe and the needle. Second thing, you can use your Ryle's tube. So after an your injection you have to again ventilate the person. So this is the way for the endotracheal tube. So hope this video is useful for you, you learn something. So do your best. Shalom.